Welcome to eMedicore, Patient's Corner Series. Today's discussion is about cystoscopy. Cystoscopy is a common procedure that allows physicians to look inside the urethra and bladder to diagnose causes of blood in the urine known as hematuria, bladder infection, severe urinary blockage, and uncontrollable leaking of urine, also known as incontinence. Cystoscopy has a high success rate. The procedure itself takes about 5 minutes. However, additional time is required for preparation. During cystoscopy, the doctor will use a cystoscope to view the inside of the male or female urethra and bladder. There are two different types of cystoscopes that are used: the flexible scope, which is shown on the left, and a rigid scope, which is shown on the right. There are few risks with cystoscopy, but they may include, but are not limited to, discomfort, minor bleeding, infection, and voiding problems. The benefit of cystoscopy is to diagnose problems that cannot normally be seen with other forms of identification, like X-rays, CTs, or computer tomography, or MRIs, also known as magnetic resonance imaging scans. For example, large bulky masses can be seen with a CT, MRI, or X-ray. However, small flat tumors, such as the one shown here, may not be seen by the X-ray, CT, or MRI, but can be seen through a cystoscope. Currently, the only alternative to cystoscopy is not having one. However, there is the possibility of missing severe conditions such as a tumor or other urinary problems. Before the procedure, notify your doctor if you are taking medication to thin your blood, such as aspirin, naproxen, or Motrin, or if you are allergic to any medication or are pregnant. You may eat and drink as you normally would. In certain rare situations, intravenous sedation or general anesthesia can be used. However, if you are going to be sedated or receive anesthesia, you should not eat or drink 8 hours before the procedure and should arrange for someone else to drive you home, as you cannot operate heavy machinery. During the procedure, your doctor will ask you to undress from the waist down and lie on the exam table. A numbing gel will be instilled or put into your urethra, and the cystoscope will be inserted. Here is a diagram of what the cystoscope will look like when it is inserted into a male urethra to look into the bladder. Sterile water or saline solution should be instilled or put into the bladder. The bladder must be empty of urine so that everything can be clearly seen by the cystoscope. After, the cystoscope is removed. After the examination, your urethra may be sore, and you may feel a burning sensation when urinating for about 48 hours after the operation. Please notify your doctor immediately if the burning sensation continues for more than 48 hours, or if you have a fever or bright red urine. eMedicore, core medical education. For everyone.
From everywhere.
Forever free.